Hello and welcome. You're watching We the People. I'm Rishika Barua. WHO, the World Health Organization, this week has issued a substandard medicine alert from Iraq for a cough syrup manufactured by an Indian firm, making it the fifth such warning for an India-made drug in the past 10 months. India-made cough syrups have been linked allegedly to the deaths of 66 children in Gambia, 18 children in Uzbekistan last year. In the United States, 3 children died and there were 8 reported cases of blindness, all linked to an eye drop made in India. Now, India has tested samples of these eye drops and found no contamination. There was a batch of contaminated cough syrups that was then flagged by the WHO in the Western Pacific, and now this substandard batch of another syrup found unsafe in Iraq, where the WHO has said that its use, especially in children, may result in serious injury or even death. Now, the government had inspected 76 firms across 20 states in March this year and cancelled manufacturing licenses of 18 companies. 26 show cause notices were also issued after a 2-day health ministry huddled in February this year. But clearly, nothing has changed on the ground. The problem has far from been arrested. Now, in the absence of a central regulator with strong punitive powers, India essentially is struggling with central and state regulators working in silos. There's a lack of enforcement actions and no consolidated database of blacklisted companies. These are some of the big problems that are governing drug regulation in India. This is well documented. A lot of analysts and critics have written about it. Now, in the monsoon session of Parliament, the government, with the intention to facilitate ease of doing business and invite investment, has passed the Jan Vishwas Bill, where over 183 provisions across 42 laws have been amended to do away with imprisonment or fines for certain offences. One of the amendments has led to a debate on whether manufacturers of substandard medicines would be let off easy by paying perhaps just a fine instead of imprisonment. On We the People tonight, we ask, in the light of this fresh WHO alert for an Indian drug, the 5th alert in 10 months, is this Jan Vishwas law the bill, is this law the law that we actually needed? The bill that has been passed, that's now going to become a law, is this the law that we actually need at the moment to fight this problem? Joining me tonight, Dinesh Thakur, public health activist, Chenu Srinivasan, co-convener, All India Drug Action Network. We have Dr. Gopal Davade, president of the Drug Action Forum from Karnataka, Dr. Subhash Salunke, former Director General, Health Services, Maharashtra, and the former Indonesia WHO country head, Dr. Anant Phadke, an activist of the Jan Swasthya Abhiyan. Thanks very much to all of you for joining us on We the People tonight. I want to begin though by Dr. Dinesh Thakur. I want to first come to you and have a whole host of questions because you've written extensively about this. The World Health Organization has flagged this 5th Indian drug in 10 months. Now, the government's carried out inspections, licenses have been taken away, etc. But is this enough to fix the problem?
Well, I mean, if the actions of the government were to fix the problem, we wouldn't have seen a 5th incident, have we? Clearly, this has been a long-standing issue, right? If you recall, the first incident in Gambia happened in late September of last year. We are in the middle of summer right now. We're in August of 2023. It's been a good 9-10 months. So if you're saying that the government has taken some action to try and rectify this, why do we continue to see these incidents happen over and over again? I mean, we've seen Gambia, we've seen Uzbekistan, we've seen Cameroon, we've seen, the Micronesia and Marshall Islands, now Iraq. Why do we continue to see this happen? What does it say about the government's ability to control this?
In your book, Truth Pill, the Myth of Drug Regulation in India, you've argued how the regulatory regime has favoured industry at the expense of people. Explain as simply as possible to our viewers tonight the major pitfalls with the Indian drug regulation currently.
It's a long-standing problem. The governing regulation in India for our medicines is a pre-independence regulation. It's called the Drugs and Cosmetics Act. That was passed by the Council of the States in India before we became independent in 1940. And over the period of the last 75 years, we've been patching it. Essentially wherever there's a problem, we've been trying to put band-aids. And our focus has largely been, the advancement of the industry rather than, protecting public health of the people. I mean, in 2019, we had 11 children die in Jammu, followed by another child, in 8 months later. Very little was reported of that because, the ability of the local press and the national press to report on these issues is obviously not there. But, you can't control these things when they happen in Gambia. You can't control these things when they happen in Uzbekistan or Cameroon. So the point I'm trying to make to you is that the regulation and the regulator that's responsible for making sure that we have good quality drugs, they just basically don't work. And that's the reason why you continue to see this. I mean, I'll just give you a very simple example. Have you read the CAG report that was recently released in 2022? This is report number 17 of the Controller and Auditor General of India. And this talks about the quality of medicines that is dispensed in the central government health scheme. You know who the beneficiaries of the central government health scheme are. Indian Army, retired bureaucrats. Many people who essentially enroll in the central government health scheme. This report talks about the fact that in Mumbai, 26 lakhs of bad quality drugs were dispensed to patients. And in Hyderabad, 24 lakhs. In Nagpur, 2.6 lakhs. Where was the discussion that the people who are beneficiaries of the central government health scheme are actually getting bad quality drugs? Have you read about the recall of these drugs? Have patients been informed that if you're taking blood pressure medication, if you're taking medication to control your diabetes, have they been informed that over a period of time you're taking drugs that actually could be ineffective or worse?
You've raised several important points. Then centralization of drug regulation, will that be the solution? Because right now, from what we understand, from what you're saying, every state appears to be just doing its own thing.
Yeah, so the drug regulatory framework in India actually is very fragmented. So if a manufacturer in Himachal or Uttarakhand makes a bad quality drug, and the drug is actually tested and found to be not of standard quality in Tamil Nadu, there is precious little that the drug controller in Tamil Nadu can actually do about it, because they don't have the ability to penalize the manufacturing facility that's located in Himachal, right? All they can do is write a letter to the Himachal drug controller saying, hey, you know what, we found a batch of drugs that are manufactured by a manufacturing facility within your remit, and these are not of good quality. And the one in the drug controller in Himachal basically will get the letter and throw it away, because it's not in their financial interest to try and do anything about it. And the Central Drug Control Standards Organization, or national regulator, is important because it doesn't have the powers to be able to do anything about it. I mean, the least of all, we don't even have a law requiring recall when we know fully well that there are bad quality drugs being dispensed as a part of the national central government health scheme.
Right. Okay. Speaking of the new law, this new Jan Vishwas Bill that has been passed in Parliament, essentially, many argue that it's going to further dilute punitive action against pharma. Now, the government has clarified that this would apply only to a certain section 27D, which is not of standard quality drugs and misbranded drugs. Do you agree with the government justification?
First of all, this notion of not of standard quality drugs are not a big problem. Even government's own data actually disputes that. Government's own data, the CDSU survey data says that the biggest problem we have in our country is drugs are not of standard quality. And, they basically poo-poo that, basically saying that's not a problem for us. That's absolutely not true. Second, let me just give you a couple of examples of the kind of stuff that falls within what they call minor issues, right? At the peak of COVID in Bihar, we had deaths in people because they were administered injections of remdesivir that were contaminated with bacterial infection. They had, the drug wasn't tested for endotoxin. There was it's a big investigation done by the Mint. There's a long report written about it as well. Those kind of things the government says are minor issues. If people die, it's a minor issue. And they're saying that the minor issue can then be compounded. The law, Section 27D of the Drugs and Cosmetics Act basically says that in the past, there was a deterrent in the law that said that if in a court of law, it's proven that you have, caused bodily harm to people with your product, you were liable to be punished with a prison sentence of 1 to 2 years. It was in the old law. What the government did in 27D with that new Jan Vishwas Bill that has been just passed by both houses of parliament is they've removed that deterrent. They basically said that now if you pay a monetary fine, you can just basically go home. The judge doesn't even have to justify why, if the product that you make that causes bodily harm to somebody, that they're not even be held punitively accountable. And that, I think, is a terrible thing for our drug supply.
Several important points that you've made, and thank you very much, Dinesh Thakur, for joining us. I want to just open this up. Dr. Subhash Salunke, if I can begin by asking you, I think a lot of viewers, including audiences who are here with us in the studios, mostly, all media students, I think the biggest question on everyone's mind is, this raises several concerns for all of us consuming any medicine, that, how do we know if the medicine that we're eating is safe? I mean, what are the kind of checks and balances in place? It does, in a certain sense, create a sense of panic. How would you sort of summarize this entire argument that has been made about the safety of drugs in India?
I think this is a very serious issue and very sensitive issue also, as you rightly stated. Generally, irrespective whether you are educated, literate citizen or an ordinary illiterate person who stays in the villages.
Yes.
Even the doctors themselves, the entire medical fraternity also solely depends upon the belief that the system established by the government will ensure that the medicine that I am consuming or I am prescribing is going to be useful for the patient and not harmful for the patient. That is the concept on which we really believe. Otherwise, if we were there to really question for each and every drug, then it will be impossible for the health system of this country to function.
Right.
But the points that have already been made are indicative that that things are really bad. I mean, situations seem to be really bad. On top of this, now we are saying that, okay, first time you do a minor offense, don't worry, you pay a little bit of fine and go home.
Yes.
I mean, the approach itself is, there are definitely the schools of thought who will say that, okay, we need to expand and enhance our capability to manufacture good quality drugs. But sometimes it happens that there are some faults, there are some deficiencies.
Let's also just, Srinivasan, if you want to come in here. I mean, India has been known as the pharmacy of the world, right? This is a country and economy we're talking about, which has for decades now supplied medicines to developing countries. There is a certain reputation that does precede us, doesn't it? What does the last 10 months and these red flags in the last 10 months do to that?
Definitely it has damaged to a certain extent. These reports which have come from the WHO have started raising doubts not only within India but outside India.
My question was for Chinu Srinivasan.
Okay. I really do not know why the last 10 months have seen so many unfortunate results from various parts of the world. Like any other sensitive Indian, I'm really aghast that many of the medicines made in India have got such a bad reputation. But like what is a populist saying that if you say something about India, good about India, the opposite is also true. One thing is, we hardly had a pharmaceutical industry, say in 1970, 300 crores. Today, even at the turn of the century, it was about 16,000 crores. Now today, the turnover of local turnover is 1.67 trillion crores, local and export. So this explosion is unprecedented.
Yes.
In a way, if you want to see the cup is half full, it's a success story. But the explosion, but the regulation hasn't kept up with the speed of the explosion. And some of the things said by some of the speakers before, it's true. But there are so many things needs to be done. And the justice system, for instance, has to be quick, has to be, it cannot drag on. And that is one of the purposes of compounding the offences, which the Jan Vishwas Bill said. And there is a kind of a sense in bifurcating offences as serious offences and not so serious offences, because there are a lot of serious, not so serious offences. And there's a list in a 2008 guidelines prepared by the DCGI. And see, it is like this. If you're driving a car and you get a parking ticket, you'll get a bill for, you'll get a fine for say 10 rupees or 15 rupees. But if that car goes and sort of dashes against a cyclist, you should get a bigger offense. But you can't say for parking ticket and for hitting the cyclist, you should get this.
Yes,
you should have the
yes.
same amount. We cannot say that. So that is why.
The other. Right. I think you raised a very important point, and I want to bring in Dr. Anand Phadke into the conversation, because what Srinivasan essentially argues is that the growth of the pharma industry in India has been exponential, and perhaps the regulation that we have hasn't really been able to keep pace. Is it that simplistic an issue?
Not simplistic, but the reality is that regulatory framework is grossly deficient. For example, right from the Marshall Committee, you get the data that the number of drug inspectors from in India, for example, are in actual, those who are in place are almost 1/3 to 1/4 of what they should have been. So with this level of very gross deficiency in the number of drug inspectors, leave aside the quality of their work, is something which basically tells you that the drug regulatory, I'm talking about the FDA officials who do drug inspection, is grossly deficient. I come from Maharashtra, whatever data that I have, not very latest, but again, Maharashtra is supposed to be a little progressive state, but we had only 1/3 of what is needed. So I think it is certainly true that the regulatory system is grossly deficient.
Right.
And even if you change the laws, we should certainly improve those, or whatever. I think that thing will not change unless you improve your drug regulatory system. Secondly, centralization is not the solution at all.
Okay.
We are basically a federal government. The constitution basically gives us, we are.
But then,
Listen, then there has to be a coordination between central and state government.
But
so
speaking,
that no criminal,
Dr. Gopal Davade, do you want to come in here? Because is there coordination between states? I mean, we just heard what Dinesh Thakur explained at the very outset about the way regulation in India actually works, and there appears to be a complete lack of coordination between states when it comes to blacklisting medicines or regulating the sale of medicines that are found to be substandard, or even sharing information about medicines that are substandard.
Yeah, thank you very much for giving me a chance to speak. Before we look into the bill, I think we should also look into how what is the Indian market now. We have so many irrational and unscientific medicines in the market. How does one make an assessment of these unscientific products at all? So I think the market, all such products which are really a public health menace should be cleared. Unless that is done, we will have all these things that are happening in a much more bigger way.
Okay.
And secondly, what I would like to support what Dr. Phadke said, that I just have this very recent report, a news item from a local newspaper, which is dated 28th October, just last year. There is 87% of shortage of drug inspectors in my state of Karnataka. And they have 696 drug manufacturers, 103 cosmetic manufacturers, 382 blood banks, and 1 lakh wholesale and retail margin. So with this market to be regulated by a very small group of drug inspectors is just beyond capacity. So I think unless these things are made to put in proper place and shape, we cannot assure quality medicines to the people
All right.
at large.
Members in the audience who have questions as well. You had a question. Go ahead. Please hand him a mic. Yeah.
हेलो सर.
Go ahead. Ask your question.
सर हमारा क्वेश्चन ये है कि सर जो भी मेडिसिन इंडिया के बाहर जा रही है और उससे जो बच्चों को जो प्रॉब्लम हो रही है और जो से कि जुर्माना लग रहा है, और उसके बाद लेकिन उन बच्चों को क्या है, उन बच्चों को क्या मतलब उनको कोई रिलीफ मिल रही है या कुछ उनसे उनको कोई फायदा होगा, ऐसा मेरा क्वेश्चन है.
Okay. So, I mean, there's obviously a lot of concern, like I said, about the WHO red flags and the data that has been made available. Would any of you like to take that on? Dr. Salunke, would you like to take that on? I mean, how is there anything that is really being done by our government to help these people?
I feel I do not have exact information what was the kind of an end, kind of a result of this investigation, and how Government of India either compensated, assisted, or supported the countries where this situation has occurred. On the contrary, I think Government of India came out with this saying that where there are not glaring mistakes, that is the attitude, then admitting that we are going to assist these children will be not very easy. So I personally feel that ultimately, and majority of these were poor children. So what happens to these children within the country and outside the country is an open-ended question.
Chinu Srinivasan, do you believe that a part of the problem is the information black hole? We don't really know what is happening when it comes to something that is relevant to each and every one of our lives?
We have 1 billion population, so actually there will be some deficiency. But if you're talking about information blackout vis-a-vis the manufacturers who is doing what, and that is not correct. Every state drug commissioner knows who's a good manufacturer in his state, who's not a so good manufacturer, and therefore you don't need it's not a rocket science to find out who they should go after, who they should monitor. And once monitored, once found out that this person is doing something which is not ethical, I think the punishment should follow. That is where we partly it's because of the judicial system. Anything and everything takes a lot of time. The cases drag on, and that again is a reason for compounding offences. Because if you compound, you can the person. It's a kind of you pay the fine, and the matter is finished.
But that's the whole argument, right? That's the whole question that we're asking about this Jan Vishwas Bill, which is going to dilute the criminalization of pharma offences to an extent. Dr. Phadke, do you agree that this bill, therefore, is the one that we need right now?
No, I can, as a public health person, I can certainly say something, but I think there are more better informed people around, so I think I will take this issue last.
Okay, you'll take this question last. Dr. Dabade, do you want to take this on? These provisions of the Jan Vishwas Bill, do you believe that it's actually going to do a disservice to the pharma sector?
I don't think so. I don't feel so.
Okay.
Because our own Commerce and Industry Minister, Piyush Goyal, says that Desh Vishwas pe jayega. He said this in the parliament regarding this bill itself. Will this bill bring in any change in what has happened in the last 10 months? This bill cannot address those issues that we are trying to tackle, because each country should have its own robust drug regulatory mechanism.
Right.
And the drug regulatory authorities should be on the toes. You see, there is so much happening in the drug area itself. What about biosimilars? What about gene therapy? So
it's an interesting argument that you're actually making, because what you're saying, to summarize all of this, is that we need to have a robust mechanism of drug regulation across states, and perhaps have your central drug regulator with more powers to coordinate between different states. The Jan Vishwas Bill is one element of it. How that actually plays out now, where it's taken away punitive action from certain provisions of pharma fraud, how that bill is going to play out in the future is a question that needs to still be asked. But as far as drug regulation is concerned, if the last 10 months in these WHO red flags is anything to go by, we have miles to go to fix what the existing system has to offer. I'm afraid I'm completely out of time on We the People tonight. Thank you all very much for joining us. Good night.